and welcome everyone to Women's Health Tech Wednesdays. I am your host, Nina Joshi, and today I am very excited to bring on today's guest. But before I do that, I just want to run through a couple of quick announcements for you all. The first is our Breakthrough Innovators Challenge. The applications are open until May 12th, so if you are interested, please be sure to check that out. We also have our April Symposium tomorrow. Going to be a really exciting and great conversation. All of the registration information is going to be in the chat if you're interested. And then also just wanted to officially announce our guest today, Ashley Dominic, who's the Program Director for Health Equity at CHRISTUS Health. As you know, we love questions here at Women's Health Tech Wednesdays. So if you have any during our conversation, make sure that you pop them in the Q&A feature at the bottom of your screen or into the chat, and I will make sure that we save some time so that we can get to your questions. So with that, I'd like to formally bring on our guest, Ashley. Thanks so much for being here today.
Hi, Nina. Thanks so much for having me. I'm having a little bit trouble with my video. Let me just, okay, perfect.
Oh, I see you.
Thank you for the patience. Thank you so much for having me, Nina, and HITLAB. It's a pleasure to be here to speak with all of you and just get into a conversation about health equity, which is a space that I'm super passionate about and that I've been working in for the past couple of years. And just to introduce a little bit about myself, I'm the Program Director of Health Equity with the Health Equity Diversity and Inclusion team at CHRISTUS Health. In terms of a little bit of background on myself, I'm a New Yorker by birth, but I'm now a Texan. That's where I currently live. So I currently live in Dallas, Texas. And CHRISTUS Health as an organization, it's really interesting. Even though our corporate office is located in the Dallas-Fort Worth region, our ministries is what we call our hospital regions, and the communities that we serve are all over Louisiana, Texas, New Mexico, and we even have an international presence in Chile, Colombia, and Mexico. So we definitely have a very unique strategy when it comes to healthcare and health equity with that as well. I also definitely describe myself as a public health professional that kind of intertwines the healthcare administrative and public health perspectives and intersections. During a lot of my graduate studies and after completing my Master of Public Health, I've had the blessing and fortunate experience of working in many different healthcare settings, including governmental agencies, nonprofit organizations, and within both corporate headquarters and smaller community hospitals. So I've really seen how strategy influences the work of our frontline folks, especially in the health equity realm. So excited to just get started with this conversation and to learn more from our audience as well in this work.
Yeah, absolutely. I love kind of the brief intro that you gave. And I mean, I am also very excited to dive into some of the global components of CHRISTUS Health. I did not know that you had an international presence. Would love to maybe start things off to kind of dive a little bit deeper into your just career journey. I know that you explained that you've kind of been in a lot of different sectors, which I would imagine have given you a lot of really interesting insights. Would love if you could kind of walk us through your journey that has led you to CHRISTUS Health.
Absolutely. So when I was in college, like many folks, I would assume, I thought I wanted to be more on the clinician side. So, treating patients, taking care of them in encounters in a hospital or an ambulatory kind of setting. Then I started to get experience with different public health organizations. At the time, I volunteered with an organization called Peer Health Exchange, which would train college volunteers to deliver standardized health education workshops in urban New York City middle schools and high schools that did not have the resources to have a more formalized health education curriculum. So from this experience, what I really enjoyed was the fact that as college volunteers and as educators, we did not tell these students what to do or what not to do. Instead, we gave them the knowledge, tools, and decision-making power to make the decisions that made the most sense with their situation or with what their goals were as an individual. And that's something that really stuck with me because so much about healthcare had become to tell the patient, this is what you should do, this is what you should not do. And especially working with folks who are from different socio-demographic backgrounds, there can be a huge imbalance in power and authority when you have a physician who is telling this patient that they might know very little about what they should be doing in terms of their diet or exercise without having access to information about their background, their education, what are the factors that influence their health behaviors.
Mhm.
And so that made me think, how can we make care delivered in a more culturally humble and sensitive manner that meets patients where they are, where they're comfortable in their communities? And when I was in graduate school, there was something really interesting that I learned about. There was a coalition that many New York City hospitals were part of, in which they would train barbers and barber shops to deliver diabetes screenings, health screenings, blood pressure screenings, cholesterol, et cetera. And then they would be able to deliver education.
Mhm.
And I thought this was so interesting just because a lot of men of color are very reluctant to go to their primary care doctor.
Mhm.
It's kind of like, it's this sense of, I'm a man, I don't need to go to the doctor, but they have a very sacred relationship with their barber.
Mhm.
They'll see their barber religiously every 2 weeks, and they feel very comfortable sharing personal things with their barber. And they have a very continuous relationship with this person.
Mhm.
So rain or shine, they'll make sure that they get their haircut. And so it was so ingenious to be able to leverage that partnership to be able to reach the patients where they were, in a place that they're already going to, in a place that they're already comfortable with. And that got me thinking, how can we continue to use very creative ways of educating folks
Mhm.
on how they can take their position and be able to use that and leverage that to be able to get to patients and populations that we're normally not able to reach from that traditional public health or healthcare perspective. So that's really what led me to be interested in the work that I do today.
Mhm.
After graduating with my Master of Public Health, I ended up going more so into the healthcare administration route with a fellowship in healthcare administration with a health system in Pittsburgh, Pennsylvania. And there I was able to rotate through different areas of hospital administration, including corporate operation, nursing, quality, patient experience, finance, et cetera. And then from there, that brought me to a role with an academic medical center in Dallas, Texas, where I served in a very strictly project management role, where I got to work on
Mhm.
really cool projects. But I realized that my heart was kind of calling me back to my true passion of health equity and public health. And that's what led me to CHRISTUS Health. So I've been with the organization for about 9 months now, learning a lot. Really enjoying this role that really enables me to use my talent and skills to be able to figure out how we can get care to our patients rather than trying to figure out how to get patients to
Yes.
the source of care. And so there's a lot more to that journey, but I think a lot of it can be summed up by just not being afraid to pivot, try new things out, and just mix and match, and just taking those experiences from grad school or from volunteering in different organizations and using that to discover what my passions were in.
That is so inspiring. I think a lot of what you were saying not only resonated with me, but I think a lot of folks, a lot of our participants today as well. I love, the idea of bringing care to people rather than having them come to you, and really leveraging community and these peer-based moments that can provide a lot of, really meaningful value. So I think that was such an ingenious idea. I love it with the barbers. But I think it just speaks to this broader theme of how can we really leverage the community and kind of the circles of trust that already exist for our patients. So I love it. I really wanted to ask you, this may be a silly question, but I'm just so curious, your own personal definition of health equity, what does that mean to you? I would also love to hear kind of what it means for CHRISTUS Health as well.
Yeah, definitely. So one of the things that I really enjoy about working at CHRISTUS Health is that my mission and personal values are very aligned with the organization. And so I would say that a lot of what health equity means is meeting the patient where they are. And especially in that example that I talked about is being able to break down those barriers.
Mhm.
Coming into a hospital facility, it can just seem so sterile. So instead of making this a very anxious or nerve-wracking experience for the patient, meeting them where they're comfortable, where they are, eliminating all barriers. Maybe it's language, maybe it's stigma, but just being able to provide interpretation services if they need it, if they have trouble with getting to the facility, getting them access to some kind of transportation. And then also just weaving health equity into all work. I think previously what happened in healthcare is that our focus was so much on the actual quality and delivery of care, which, don't get me wrong, is of course very important. But health equity and healthcare disparities, it kind of became this niche market where there were just a few people interested in it, and it became sort of an afterthought. Now, what's really important to not just my organization, myself, and I think a lot of folks in healthcare is interweaving the work of healthcare equity and healthcare disparity into everything. The way that we do and think and plan in healthcare in general should always take into account how we can make care affordable, accessible, culturally humble, and just applicable to the needs of our patients, and making that part of our culture and our blood, interweaving it into everything we do, rather than, it's a separate committee that's going to take care of it, or we have our diversity and inclusion or health equity director who's going to take care of that. No, it should really be something that everybody from all walks of the organization, whether it be nursing, quality, physicians, informatics, it's something that everybody needs to get involved in and really be a stakeholder in. And so that's something that's really important to our organization. And we've taken many steps over the past couple of months to really ensure that all the different departments that touch this topic are involved in the decision making. So it's not something that just our department owns, it's something that everybody is accountable for and is involved in decision making with. So that's really helped us. But definitely health equity is something that just makes sure that the patient is as comfortable as can be, and that whatever their needs are or are accounted for in that process. And that we make care centered to what they might require of us as healthcare practitioners and providers.
Absolutely. That is so powerful. Thank you for sharing that with me. Just, this worldview I think is so important. I really like that you are kind of really seeing how it needs to be something that's like the stitch of the quilt. It's like bringing everything together. It's through everything. So that also really resonated with me. Would love to ask you, I know that there are, so many opportunities when we think about the work that can be done and really bridging these gaps that you're seeing, but would love to kind of get a sense from you and the work that you're doing. What are some of the key challenges or the key initiatives that you are kind of focusing in on right now?
Absolutely. So a couple of the things that we're really focusing on are especially the CMS and Joint Commission regulatory requirements that are coming down the line for health equity and healthcare disparities. So both these regulatory bodies have released a couple of different domains and requirements that they're looking for hospitals to participate in. Right now it's voluntary, but starting in January 2024, they are going to become mandatory. And so we are really ramping up and getting folks ready for that. So something that we are really excited about is we just approved our new social determinants of health assessment, which is going to be in both of our EMRs. We're working with both. Some of our facilities are on Epic and some of them are on Meditech going on to Epic. And so that's been a challenge that we've been working through different EHR technology, but we're happy to announce that we have our assessment on both of them and they are live. So that's really going to help us be able to officially screen for the social needs of our patients. Something else that we're working on is a way that we're able to close the loop on communication between the patient and whichever community partnerships or resources that we refer them to. This has definitely been challenging because it's not a capability that we currently have for all of our ministries or all of our regional hospitals and ambulatory centers. So we're trying to work through some creative solutions on how to do that. Some of our centers will have access to findhelp.org via Epic. Some of them will have to manually go to findhelp.org, and some of them will be using a community resource database that we're going to be putting together manually for now until we're able to switch them over to the Epic version. So that's something that we are excited about, but kind of working through some of the challenges and kinks with, because while we refer the patient to the different community resources or partnerships, we also want to be able to get that bilateral communication back about how the patient is doing, what are some other resources or partnerships that we want to explore. Something that we're really looking into is the role of community health workers. We just received a grant from AmeriCorps that's going to allow us to have community health workers embedded through some of our sites. And so we're excited about that because that's going to help with closing that gap and making sure that our patients are getting access to the services that they need and that they're followed up with appropriately. Another thing that our system is heavily working on is being able to stratify data. So once we receive the data from our social needs screenings, how can we use that data to figure out what are the different issues that our populations are experiencing, and how can we leverage partnerships even ahead of time So if we notice, for example, in a specific zip code or in a specific region, a lot of people are experiencing homelessness
Mhm.
or food insecurity, what are some partnerships that we can work with ahead of time,
Mhm.
so that we can make sure that we are up and ready to go to connect patients to future resources when we identify that that's a need. So those are some of the things that we're working through right now. And I think a lot of systems are kind of going through different challenges, figuring out how to do that in a creative way based on the resources that they have, but also figuring out what are new resources or partnerships that we need to build in order to make that more robust for the future.
Absolutely. Wow, there are so many interesting initiatives. I want to just dig into all of them, but I think a good place, I think, to start is the community partnerships that you were referencing. Would love if you could share a little bit more about kind of how you see this partnership, kind of the relationship, and how kind of working with CHRISTUS Health, and really the benefit of leveraging these partners.
Absolutely. And what's really interesting is that even though we are a big Catholic health system that spans across many different countries
Mhm.
and ministries from a regional perspective, what's really important is these local partnerships. So each of our hospitals, their leaders are very well in tune with the needs of their specific population. And our hospitals, a lot of our sites are more community hospitals. So they might be, some of them are big, some of them are smaller in nature, depending on the area that they serve and the population that they serve. But having those community partnerships means that the patients in that region are able to get the care exactly how they need it, when they need it, in a way that's cognizant of their specific needs. So for example, a lot of our patients are primarily Spanish speaking patients.
Mhm.
And so that's really important, being able to have community partnerships with organizations that are comfortable in delivering their care and education in Spanish, just to give an example. We also have populations that are heavily Vietnamese speaking, for example. And so it would be important for us to have community partnerships that are able to speak that language and be able to deliver care to them that is cognizant of their language needs.
Right.
That's really how we've been able to deliver care, because we understand that not all of our clinicians are equipped to, they might have the clinical knowledge, but they might not have that cultural expertise or knowledge.
Mhm.
And so this has been able to free them to focus more on the clinical, and then using those community partnerships to make sure that we're able to focus on the cultural aspects. So
Absolutely.
for example, if a patient coming in comes from a specific culture where they are heavily reliant on rice, for example, it
Mhm.
wouldn't be fair for a dietitian to tell them, completely cut rice out of your diet,
Mhm.
in order and for your health reasons. So we would refer them to services, community partnerships that can help them understand their dietary needs and work with their cultural constraints as well. At the end of the day, we don't want to tell patients what to do or what not to do. Instead, we want to work with them, work with what they are used to, and make sure that we're able to create a plan for them that is not going to completely steer them, 180 from what they're currently doing, but rather works within those limitations. And we also want to celebrate those cultural differences, which is what cultural and community partnerships allows us to do. It allows us to say, we're able to work with this specific population, and deliver needs that are sensitive to what their culture prefers.
Mhm.
So that's been something that's been really important to our patients and the families and the communities that we serve. And that's something that we really pride ourselves on, is being able to leverage that power.
That is absolutely phenomenal. And I really, as you are kind of explaining just the myriad of benefits, I mean, I think it really is just all encompassing, really being able to be in partnership with community and kind of bringing them along, I think is really beautiful. Also, when you were kind of talking about some of the work that you're doing around the data component, I thought that was so fascinating about being able to leverage data and kind of some of the things that your patients are telling you to be more proactive. Would love if you could share a little bit more about kind of what that looks like, since I know, the power of data just continues to be more and more visible. Would love to share kind of just anything that you're working on in that space, or any interesting insights that you've maybe gleaned.
Yeah, absolutely. So we're actually working with our health outcomes team. So we're going to be creating a health equity dashboard. So this dashboard would be able to allow us and the ministries and the hospitals that we serve, their leadership, be able to take a look at how we are doing in terms of a perspective of, how is this race doing in regards to this health issue? How is this race doing in regards to this health issue, and see where the differences lie. Right now, this is something that we're piloting and just starting, and so we're still building it up, but we're going to be focusing on heart disease as our first health concern. Just from our community health needs assessments and our community health improvement plans throughout our different systems, throughout our different hospitals, we noticed that as a system, the two major things that we want to work on for this coming 1 or 2 years is heart disease and food insecurity, because that was identified as a need with basically all of our hospitals. And so one of the things that we're doing to tackle that from a data perspective is be able to have better visibility into how different sociodemographic groups are doing with heart disease. So that's something that we're really looking to build out over the coming months and be able to take a deeper look into. And what we're asking is, once this dashboard is built for each of our hospitals to, they have something called community advisory committees. So these committees would take a look at the dashboard, see what the issues are, and based on which races are experiencing issues with heart disease, be able to develop some action steps that would directly be able to correlate to their work. So that might mean, doing more blood pressure screenings, or it might mean being able to take some more action steps on educating the patients on heart disease. So whatever is appropriate for that specific hospital. But that's something that we're really trying to do, to be able to take data and then make it more actionable. I think that now, with just the way that healthcare is moving, we have access to so much data, which is amazing. But it's easy from a corporate perspective to say, we have this data and this data. How do you take that and make it operational at the hospital level?
Right.
So making sure that our leaders not just have access to see the data, but then have tools in which they can actually take that data and then make next steps from it. And take that to the different departments and community partners that they're working with. So that's something that we're currently working through right now. We're really excited about this health equity data dashboard because it's something that we did not have before. And I think with the CMS and Joint Commission requirements coming down, it actually, it was something that we were working on, but being able to have those regulatory requirements coming also helped kind of create that inertia to really move that forward. And so that's going to be a very instrumental tool to just move forward a lot of the work that we're doing in that space.
Yeah, and I really love that you call out, not like data and gathering the data is the first step, but actually making it actionable is kind of the magic behind it. So I like that you called that out. And it's so interesting that you kind of, leverage what you're hearing from the community to kind of pick heart disease and food insecurity. I'm so curious, are there just, from what you're hearing, are there any other like priority areas or topics that are kind of bubbling up as something that is, a priority for this year, or just something that you're kind of seeing in the communities or in the environment?
Oh, absolutely. So a couple of other issues that really bubbled up as areas that a lot of our hospitals are dealing with as well are smoking / tobacco. That's a big issue. Asthma. I would say just lack of transportation. That's been a major insecurity, housing insecurities. And so that's why the social needs questions are going to focus on those items, because those were identified as major issues and challenges that our patients were experiencing. And so we want to continue to collect that data and figure out what are the partnerships that we could use in order to meet those gaps. And so while as a system we're focusing on heart disease and food insecurity, our hospitals are still going to be focusing on their individual community health needs assessment priorities that were identified through their process of vetting different focus groups, different stakeholders. And so we're really excited to see the work that they do. And ideally, they're going to be creating partnerships with each of the different social needs and health needs that they've identified. And so we'll be able to have a very robust list of resources that we're able to refer our partners and our patients to once, that social need is identified.
Absolutely. And kind of on that note too, one of the initiatives that you had mentioned is really kind of creating that like closed system where, patients who are referred out still feel like that line of communication hasn't closed, which I think is so important. And also very curious, I know there's a huge, I would imagine, just repository that you all probably have of all of these resources. Is there kind of any work being done to be able to streamline that and kind of make sure that whether it's the care providers or other folks are aware of all of the various organizations or resources out there?
Yes, we're actually currently putting together a database. Right
Oh,
now, it's
nice.
going to be manual, just with us being on two different EHR technology platforms. Once everybody is onto Epic, then we're going to focus more on how to integrate that just into Epic solely. But right now, we are putting together that manual database, and we are, once that's complete, going to be doing some more robust education with our clinicians, especially in our hospital and ambulatory settings, to be able to ensure that they understand, because this would definitely be in alignment with what they're currently doing, but we just want to make sure that we're updating those resources. We're adding new partnerships, maybe reevaluating partnerships with already existing ones. And so just so that they're, aware of how to go through that proper referral platform. And then in terms of the closed loop, we don't have that quite yet. So that's something that's going to be in our next stage of building out that community resource platform, figuring out how we can get that communication back from the partners that we're working with to understand more about the patient needs. And that's where we do see that the community health workers are going to be super helpful in bridging some of those communication gaps and barriers that currently exist.
Absolutely. Yeah, I think that's incredible. And on that note, we actually have a question from a participant who wants to know, what are the qualifications for a business or nonprofit to partner with your organization?
That's a great question. We actually don't have any qualifications that I know of right now, but if you can give me your information, I can actually send those to you. We definitely have some more legal terms and definitions. So I don't want to give you the wrong information. We also have a team that I work with at CHRISTUS Health, our community benefit team, who does a lot of those partnerships and resources and referrals. What I can definitely do is get your information over to them, and they can send you some more resources about how we can move forward with that partnership building. That's something that we are really open to exploring, especially as we're learning more about different partners that are coming up in the areas that can really help us with bridging the needs of our patients.
Absolutely. And so actually this is another great follow-up question from our participant about what is the best way to send a partnership proposal over to you. We do have your LinkedIn in the chat, but do you prefer for them to email you, LinkedIn message you? What is the best mode for you, Ashley?
Yes, you can LinkedIn message me, or you can directly email me. I'm happy to respond to either, and then I can get your information over to the correct people that we're working with on the community benefits side. So I would love to do that. And thank you for the question.
Wonderful. Yeah, this has been such an inspiring conversation. I can't believe it's time already.
I know. I'm like, no.
I think that there is, you are just inspired me. What a great conversation. I think there's just so much amazing work that has kind of already gone underway, and so much amazing opportunity ahead. So I'm really excited for all the amazing work that you are continuously doing with your communities. So I really appreciate you taking the time to chat with us today.
Absolutely. Thank you so much, Nina. Thank you, HITLAB, and thank you everybody for the wonderful questions.
Wonderful. Just wanted to also thank our sponsors for sponsoring this conversation. Also wanted to just kind of continue on with the updates. If you are interested in any of those events, please check the chat and join us next time for our next conversation. Also wanted to give one last huge shout out to Ashley for such an amazing conversation. Like she mentioned, if you are interested in reaching out to her for any additional questions or partnership opportunities, her LinkedIn information is in the chat. And she also just put her email in the chat as well for any questions. So looking forward to kind of seeing what bubbles up from that. But in the meantime, hope you have a great rest of the day, and we'll see you next Wednesday. Bye, everyone.